We will start with activity number 1 and 2. Here in the activity number 1, we will do, the aim is to hear the lub dub sound of the heart. Heart sound we have read, whenever there is a systole and diastole process, the heart makes a lub and dub sound. So to check it, we place our ear on the left side of the chest of our friend, and then we check the heartbeat. And if we check it for 1 minute, it comes out to be, the rate of heartbeat comes out to be 72 times. Similarly, in activity number 2, to check the pulse rate, we put our index or the middle finger on the right hand side, inner side of the wrist, and then we try to feel the pulse. That is a regular throbbing or regular rhythm or beat of the pulse. And then when we count the pulse for 1 minute, it comes out to be 72. So earlier also we have read it is equal to the heartbeat rate and 72 times per minute for a normal healthy person. So heart sound, that is lub and dub, and pulse rate, they both are same. Whether we check the heart, we hear from the heart when we put our ear to the chest of a person, or we try to check the pulse rate by putting it on the inner side of the wrist. So they both comes out to be 72 per minute. Activity 4 and 5 we won't be doing. So activity number 3, here to know the names of the blood tests and their detectable diseases. We have got 7 diseases here and the blood tests for which we do it. So as the name suggests, blood test, we draw the blood from the human body and we check the diseases. In the first one we have the diabetes. Now diabetes is a condition that impairs the body ability to process blood glucose, and the hormone insulin is either not produced in the much required quantity or is not effectively be used. So what happens, the sugar level in the blood, it increases. For that we take the blood sample to check the blood glucose level. Second one is anemia. Anemia is the condition where blood doesn't have enough healthy RBCs in the body, therefore it reduces the oxygen content in the body. For that we take hemoglobin estimation. Third one is polycythemia and anemia. Polycythemia means the increased RBC in the body. So for that we do the RBC count. In the fourth one, WBC count, that is white blood cells. We are aware that white blood cells are responsible to fight against any disease or foreign body which enters a human body. So when the WBC count increases or decreases, it increases whenever a person has any infection. So if we check the WBC count, we can come to know that person is suffering from some infection or the other. Fifth one, PVC, that is packed cell volume or hematocrit valve of blood. It is to identify anemia or polycythemia. Anemia is a reduced amount of RBC or less amount. Polycythemia means increased number of RBC. So here it is to check the ratio of the RBC to total volume of the blood. So we draw blood from a human and we run this blood test to check the disease, polycythemia or anemia. In the sixth one, ESR is done for rheumatic fever, tuberculosis or any malignancy, basically for the joint pains, arthritis, pain in shoulder, neck, abnormal weight gain. So here ESR blood test is done to check the inflammation in the body. Seventh one, Elisa test. It is to measure and detect any antibody in the blood related to certain infectious condition. It is done to detect the virus infection like encephalitis, yellow fever, dengue, cancer and HIV. Now if a person is found positive, this ELISA test is found positive, it is followed by another test, that is Western blot. So these are the tests. Now in all the blood tests, we have to draw the blood, we have to take the blood from the human body. And we all are aware, whenever we get any injury, the blood vessels are opened, the blood which comes out, which oozes out of our skin, it quickly clots. In our body we have the clotting factors that induces the blood to clot. Now if we put the blood into a plain glass tube, that is with no anticoagulant in it. Now we will be talking about the anticoagulant, what anticoagulant means. Anticoagulant is anti-clotting. So if we put blood into a plain glass tube with no anti-clotting or anticoagulant in it, When the blood touches the glass, plasma proteins is activated, which initiates the clot formation. Now, had it been in the body would have produced some protein for the clotting there, and here also the clot formation occurs. If the blood coagulates, if the clotting occurs, it will be of no use for the blood sample. The blood sample will be of for any test. We would not be able to run any test because the blood has clotted. To avoid the situation, to avoid the clotting of the blood in the test tubes, we add anticoagulant, that is sodium citrate, which is a blood thinner to prevent the clotting of the blood. So anticoagulant is the blood thinner or anti-clotter which is added in the test tubes to avoid the clotting of the blood, so that the blood test could be run smoothly.